So we have absolutely no idea what palliative care is, so please enlighten us.
Educate us.
I have no idea what palliative care is. Never heard the word. But I do know what a palate is.
To do with like your
palate.
My understanding of it is it's helpful in the communities that where people need assistance, health assistance in terms of hospice, frail care, and yeah, that's my understanding of it.
Palliative care, I think, is purely patient-centered care, whereby they are treated with dignity, care, love, and lots of support.
Okay. Well, I got ambushed by these three young ladies. Firstly, they asked me about palliative care, which I don't know what that is. I've never heard of it. And I thought they wanted to ask about my weight, but okay. So basically, I don't know what palliative care is.
Make their not dyingness like comfortable.
You make their exits into the afterlife more comfortable.
Well, I definitely think it's an alternative form of care.
What I understand about palliative care is it is a subspecialty of medicine where we provide specialized care to patients who have a chronic diagnosis or a terminal illness. We provide comfort in a time of need to these patients in a multidisciplinary approach, dealing with different aspects and domains of care.
Measures to reduce pain in circumstances where perhaps there's not an outright cure.
Do not understand what it is, and palliative care is fundamental to health and human dignity, and it is a basic human right.
So over the last 10 years, our palliative care program at Victoria Hospital started with a young man who died from kidney failure, and we asked the question, could we have provided him with better quality of care? And we then realized that if you are having cancer, you get special care, you get hospice care. And we wondered, why would it be that if you are a patient having kidney failure or heart failure or lung failure, that you don't get this hospice care? So we did some research and we found that there is palliative care, and we had to train ourselves in palliative care, and thanks to the Hospice Palliative Care Association of South Africa, we received some training, and over the next few years we developed a program that has grown from strength to strength.
I work at Abundant Life Victoria Hospital. My job is bedside counseling most of the time in the wards with patients who have been referred by doctors to Abundant Life. So we do assessments, most of the time sitting at the bedsides of patients, listening to them while they're going through a trial time and understanding their diagnosis and what the doctors have told them, and most of the time just being there listening to what they have to say, or just support. Like, presence is powerful, being there for the person while he's going through or she's going through a difficult time.
Palliative care can be provided just at the beginning of the person's diagnosis, when they are diagnosed with a life-threatening illness. So it should not be given at the end or towards the end when people are dying. So palliative care is offered to people who are living.
Palliative care is actually very much less about dying, but all about living life to the full.
The public should know about palliative care. Patients should be able to request palliative care when they are at that stage, when they need it. Families should be able to also request palliative care for their loved ones. And the other reason why people should know about palliative care is that there is a misconception and a misunderstanding of what palliative care is about. And people think that when a doctor refers a patient for palliative care, then it's like writing that patient off. Yet, palliative care is quality care, and it is really one of the best care that patients and families would get.
We are trying to do for our patients and their families is to ensure that they actually have better quality of life, better understanding of their medical conditions, and have actually got a way in which to plan the future of their lives.
Illness affects everybody. It affects the patients, it affects family members, it affects even the dog in the family. So we need to be able to understand that and make people realize that even though we cannot stop the actual death, but the journey towards that should be a journey that is not distressing and filled with pain.
When I was sick, 48 kilograms in weight, my son said to me, I said to him, rather, I have, what do you think of my physique? He said, Daddy, you are a bag of bones, but one thing you must remember, you have a mind and put it over all things and you'll get well. And here I am today, able to do something. That is Mr. Kibero. That's why I have much time for abundant life.
Because every time you come here, you learn something more about your illness, not only your illness, other people's illness and so you can appreciate abundant life, can help other people take care of their illness. I'm proud to be an abundant life patient. I'm not a patient, I'm a survivor.
Besides Dr. Kibido, who's a real star, I think all the carers, Kathy and Jenny and Elizabeth and Glenda and even Shanaz, who provides the food, and even Justine and Sister Pachu, they have a wealth of information which really puts us at ease. Thank you.
Everyone who talk about the illness at every meeting as if nothing was wrong with them. The acceptance of the condition that they were in was like someone that had a common cold, if I might say. Most, if not all of those present, felt it was like a family gathering.
Yes, abundant life. You know, it's not only just about the patient, but it's about the family also.
Palliative care is going to get bigger because palliative care is founded in Ubuntu, and Ubuntu is founded in palliative care. You know, it's like they are intertwined. So when you practice palliative care, you are actually practicing Ubuntu at its best.